Good afternoon, friends. Thank you very much. Now, coming to the topic, nip the evil in the bud. Homeopathy in precancerous conditions. Friends, this is the best area where we can show the efficacy of homeopathy. Why? Because once a patient lands up with the cancer, then it's not always possible to cure the patient completely. So, there are certain precancerous conditions. I have brought up three, four cases, but due to the time constraint, I think I can go with one case where the patient was with multiple diagnosis like typical and atypical fibroadenoma of the breast. Grade Bired's grade was 3 oblique 4A, where there is suspicion of malignancy. Gallbladder adenomatosis plus a big uterine fibroid. The size was 10.5 centimeter into 10 centimeter. So let us see what happens. I'll skip some of the slides so that I can go to the second case directly. This is the case. This is Mrs. X Kaur, 43 years female. She came to me on 18th April 2022. Kindly note down the dates so that we can see the efficacy of medicines. Now she came to me with the complete pain in both the breast and small nodule-like growth in right breast since 3 years. 2 days back, she found intramural uterine fibroid 10.5 into 10 centimeters and GB adenomyomatosis in the UCG report and depression since after marriage. The final one was dysmenorrhea since 5 to 7 years. History of complaints. Regarding the first symptom, breast complaint, pain in both the breast, more in the right side, started in 2019. It was aggravating before and during menses. This was the peculiar PQRS I could find. The pain was before and during menses, and after exertion, the pain extends to axilla. There was some nodule-like feeling in the right breast. Patient was worried about it and it could not take proper sleep. She got her sonomammography done on 23rd December 2019 and found benign right breast fibroadenoma. This was the beginning. She started homeopathic treatment, but due to family issues, she could not continue it regularly. Then COVID period started and the treatment was totally stopped. In 2021, again she found his sonomammography done, and in April 2022, before coming to me, her mammography showed bilateral fibrocystic disease of breast consistent with left breast Bired's category benign 2, but in the right breast there was typical and atypical fibroadenoma right sided. Bired's category 3 oblique 4A. And regarding the uterine complaint, she told that she had pain in the right hypochondrium since 2019. Doctor advised her ultrasonography. The report was polyp in the gallbladder and fatty changes in the liver. She took on and off homeopathic treatment but could not go for the follow-up scans. In 25th January 21, she was found to have chronic cervicitis. This is also pre-malignant condition. But in April 2022, she got this three diagnosis which I have told you. Now, regarding the depression, she has depression since after marriage only. It starts in the early morning on waking up. She feels severe ghabrahat, anxiety, which she can't explain. She thinks that how would she get up? How would she do household work? How would happen with her? What would happen with her? Someone will reproach her. Would she be able to do this or that or not? All these thoughts used to make her depressed. When she gets up and gets busy in the work, she feels better. There is This is her daily sufferings. She doesn't know how to get rid of it. She always remains anxious about perfection of her work. Otherwise, someone in the family would scold her, nag her, would say, "You did not do this, you did not do that." She takes tension of her work very much up to the level of anxiety. This kept on going for a long time. Then she started feeling that someone is observing her. in the family, because this kept on going on for a long time. Then she started feeling that someone is observing her, and therefore she has to complete her work in a fixed time. People are observing in the family that am I doing my work in time or not? Always looking at the watch, thinks that work is not done or it is pending. She is not satisfied with her work also, cannot explain why and how. She doesn't know why this is all happening with her. She cannot concentrate on the present work. She thinks about her the next work. Feels herself incapable. Always considers about others' expectations and ignores herself. Feels sometimes something is wrong in the brain. This anxiety is continuously going on inside her. There is one strong fear, but she doesn't know fear of what. She says there is some unknown fear. It used to come during daytime when she sleeps for a few minutes and wakes up. Then this fear, rather attack of fear would come. She feels that she is finished now and used to feel as if she would die. And she was living a miserable life with all these complaints. She has severe anxiety also, which is particularly about her children, about their education, and about her health also. Now, the dysmenorrhea, her menstrual cycle is of 30 to 35 days. She has painful periods. She gets cramps in the abdomen, and first day she remains in the bed and feels as if someone has beaten her body. Pain in the breast before and during menses. Now, the treatment history was only she has taken homeopathic medicines for most of her complaints. In the past history, skin allergy with urticarial itching, applied many external ointments in childhood and later treated with homeopathy. She had tuberculosis in 2005, uterine prolapse in 2015. After delivery, it was treated with homeopathy. She had piles 10 years back, treated with homeopathy. Leukorrhea since 15 years. PCOD in 2011, took hormonal treatment to conceive the baby. Now, family history there was father died of cancer. He also had diabetes. The uncle and brother, they are also having diabetes. In their children, in their family, the diabetic history was strong. Mother and sister and their cousin sister, they are all having thyroid problem. Maternal aunt and maternal grandmother, they are tuberculous. Father and his brother are hypertensive. See the complicated family history and the past history of the patient. Now this is the investigation report. You can see from here what I have told you, the different timeline. In 2019 it was gallbladder polyp. In 2019 again fibroadenomas. In 2021 again breast simple cyst, chronic cervicitis. This was the important report before she came to me. This was the report. In 2022, this was the sonomammography. By Red's category, it is shown, and this was the ultrasonography. You can see the size of the tumor, fibroid tumor. Here it is there, 10.5 into 10 centimeter. It was a huge size. This is the largest size I have ever found in my clinical practice. Now, the diagnosis already I have told you. Now, what was the purpose of the visit of the patient? Because she was advised to go for surgery for her uterine fibroid, gallbladder adenomyomatosis. This is not curable with the other medicines. It is a surgical condition, gallbladder adenomyomatosis, and for fibroadenomas. But she has strong fear of surgery. She wants substitute for surgery and for her problems. Now, patient as a person. Friends, whenever you take any chronic case, there are certain headings you should must ask from the patient. All these points, every point if you record from the patient, a well taken case is half the field one. Sometimes in hurry we miss many of the important informations. Many of these headings we are forget, we forget, and we do not have the complete information. So in this patient, appetite was decreased since 20 days, desire for spicy, sour and salty food, aversion to rice, thirst was normal, digestion was slow, stools were insufficient, urine normal, and she has right-sided sciatica also. Sleep position, it was she prefers to lie on the left side. She gets up in the morning unrefreshed in the morning, dreams of past events, anxious dreams, dreams of unsuccessful efforts. Perspiration is normal, thermals are chilly, female patient having leukorrhea that is white and watery, aggravates after taking spicy food. Sexual desire is diminished. She feels weakness after question. It's a painful question also. In the mind of the patient, she has fear of operations and anxiety about children. Life space, she was married in 2003. The family atmosphere was not good for her. Many a times she felt humiliated. She spent her time in an anxious condition. Friends, here I want to have your kind attention that this lady, she had problem more in the right side, typical and atypical fibroadenoma in the breast. If we read the Hammer's theory of German new medicines, you can get the information that right side belongs to the partner and the left side belongs to the mother and child. Any problem, any emotional issue which is relating to the mother and child, the female will get problem on the left side of the body. Left breast will be involved. But in this case, the problem was from the family, in-laws family. So her right breast was involved. So it helps us to take the history in a beautiful manner if we know the laterality of the case, the side of the breast involved. Now, defining the problem. This is what we read from the third aphorism. What is to be cured in the case? We have to define the problem before we proceed further. In this case, we need a medicine for an obese chilly patient who has uterine fibroid and fibroadenomas in her breast and is very anxious about trifles, about what others say about her children, about her health, very sensitive to rudeness and reprimands. Sorry. And having a fear of operation, of unknown fear, having delusion as if someone is observing her, having dreams of unsuccessful efforts, of past events, having weakness after question, having pain in the breast before and during menses. Now, after doing this, as very rightly Dr. Niranjan Mohanty sir told us that after taking the case and symptoms, we have to classify and evaluate the symptoms with the gradations. So, this is the next step, classification and evaluation of the symptoms. I made three categories, mental journals, physical journals and particulars. So, you can have a look over this. Along with the grades, I have given the intensity of the symptoms. Why? Because what is present in the patient should be present in the medicine. It should be relevant both the sides. Then only we can have the similia similibus curanter. So intensity of the symptom is very, very important to understand and to take into consideration before we prescribe the similimum. Now, because this patient has mental journals, physical journals, and good particulars, so selection of repertory. Because after this only we have to see which repertory we have to open for the case. In this case, synthesis repertory, which is the extension of the Kent's repertory, was used. This is the selection of the rubrics. You can see ailments from anxiety, mortification, anxiety about children, anxiety about her own health, anxiety work, inclination to work, anxiety with cowardice, delusion, watched she is being, fear of operation, fear of unknown things, occupations, amelioration, sensitive to reprimands, to rudeness, menses too late, menses too late. Menses painful at the beginning, uterine myoma, before and during menses there is breast pain. So these were all. Any idea about the medicine? Students, please. Okay, no wasting time. I took the case, only 4 5 rubrics I took in the first because just to make the concrete PQRS totality, we cannot prescribe the medicine without these rubrics. This is the soul of the case. Mind ailments from anxiety, fear of operation, each means is painful in the beginning, tumors, fibromyoma, and when I took the complete rubrics into consideration, all the rubrics I put it here. So just to justify what I have done with the 4 rubrics, whether the other symptoms of the medicine they fall in the same category to Calcarea carbonica because this was the medicine for her. So repatriation result was Calcarea carb, Lycopodium, Pulsatilla, Staphysaggary and Silicea. These were the 5 medicines that came up after repatriation. Now the next step, friends, is to analyze the repertorial result. Now, Calcarea carb, it covers most of the important symptoms of the patient. It covers ailments, different anxieties, fears, delusion, which is very, very important for us, dreams and thermals also. Lycopodium, though it covers many important symptoms like Calcarea carbonica, but it does not cover anxiety about children. Rather, it has an opposite symptom. Lycopodium escapes from the family and children. Staphylococcus aureus, sometimes I thought it might be Staphylococcus aureus, though it seems very close to the patient, but the pain in the breast, which we know sphere of action of the medicine should be present there in the medicine. Our medicine should be having strong sphere of action, otherwise it will not work. It also misses Staphylococcus aureus, it misses the breast pain, delusions and important fears. Cilicia, it also was very close to patient, but it also missing the important fears and delusions and breast symptoms. Now, prescription was Calcarea carbonica 0 by 1. It was started now, but we have to see the follow-ups. Friends, Dr. M.L. Tyler says if we prescribe the right medicine to the patient, we can complete our cure in a shortest way. If we give the minimum which is near to the patient symptomatology, though we can cure the patient after using so many different medicines one after other, but it will take longer time. Number two, I have seen in my clinical practice when I use 50 millismol potencies, in many of my cases, the duration of the treatment, it has been shortened by one half, one fourth, even sometimes more also. This is what Dr. Honeyman says in 246 aphorism. Okay, in this case, if we see the follow-up, appetite is better now, leukorrhea is decreased, has better sleep. She got attack of depression with that. She wanted to kill herself or leave the home. It was due to family atmosphere. Now in the next visit, depression and ghabrat is better. She feels tied up due to workload at home. Anxiety about health is less now. Breast pain this time is very less. Menses are not that painful, though it was late by 3 days. See, I was wondering if Calcarea carb would be the medicine for the patient having late menses. Then he opened Boger Bonication's repertory. Yes, it was written there that it can be given to the patient having late menstruation. Though Calcarea carbonica is famous for the earlier and profuse menses, but it is also indicated by Dr. Boger Bonication for the late menses. This is the somewhat PQRS for me. Now she feels tired up due to workload. Anxiety about health is less now. Breast pain this time is less, very less. Menses are not that painful, though it was late by 3 days. Now, slowly, patient started improving. All the rest of the symptoms are also going back. And in the month of July, after 3 months, she feels peace at mental level as she is improving 20 to 25%. She feels better overall. Now again, in the month of October, she feels that anxiety is decreased due to good behavior of the family members. Friends, it was not the behavior of the family which was improved, it was the Calcarea carb which made the patient's mentality not to bother about the environment of the family. Family members, they were not changed, but the mentality of the patient was changed with this Calcarea carbonica, because now we have to see the report also after this. Breast pain decreased to 35 to 40%. Now, in the month of November, when she came to me, she was very happy, feeling much better at her emotional level. Last month, she did not feel pain in the breast. Menses were at proper time and the flow was normal. There was no pain in the beginning of menses. The unknown fear, depression and ghabrat are 80% better. Even she has lost weight by 3 to 5 kg after Calcarea carbonica without putting anything as a dietetic plan. She reduced the weight also. Calcarea carb has reduced her weight by 3 to 5 kg. I request to get me the report of the sonomammography and ultrasonography of abdomen done. Let us see. See the result. In this case, the sonomammography shows bilateral simple cyst, BIRATS category, right-sided 6 into 5 ml. There is one small cystic growth, very insignificant size. There is no right breast atypical and atypical fibroadenoma which was there earlier. You can see here impression bilateral simple cyst by By-Rats category only 2. We have brought back this patient who was going towards cancer. So it is a condition where homeopathic medicine, calcarea carb, has played a role. Not only this, let us see the next report. This is the ultrasonography of the patient after almost 8 months. If you see here, the last line, small uterine fibroid, it was only 1.1 into 1.4 centimeter. It was for the first time I have been able to reduce the size from 10.5 centimeter into 10 centimeter to this negligible size. So this is the patient. If I am able to play the video, then I will definitely would love to all of you to watch this video. Aditya,
अप्रैल 2022 में
हाँ जी सर,
आपके जो 2 टेस्ट मैंने आपके देखे थे उस टाइम पे, उसमें एक तो आपका सोनोमोग्राफी था दोनों ब्रेस्ट का, जिसमें आपको एटिपिकल फाइब्रोएडेनोमा आया था, जिसका बायरेट्स कैटेगरी 3/4A था, जो कि सस्पिशियस था कि ये कैंसर की तरफ जा सकता है ना।
हाँ जी।
और दूसरा जो था आपका पेट का जो अल्ट्रासाउंड था, उसके अंदर आपका यूट्राइन फाइब्रॉइड था
Aditya,
जो 10.5 इंटू 10 सेंटीमीटर, नॉट मिलीमीटर, सेंटीमीटर का 10.5 और 10 सेंटीमीटर का जो था एक यूट्राइन फाइब्रॉइड था। और जितेंद्र कौर जडेला से मेरे पास आई थी अप्रैल 2022 में।
हाँ जी सर,
आपके जो 2 टेस्ट मैंने आपके देखे थे उस टाइम पे, उसमें एक तो आपका सोनोमोग्राफी था दोनों ब्रेस्ट का, जिसमें आपको एटिपिकल फाइब्रोएडेनोमा आया था, जिसका बायरेट्स कैटेगरी 3/4A था, जो कि सस्पिशियस था कि ये कैंसर की तरफ जा सकता है ना।
हाँ जी।
और दूसरा जो था आपका पेट का जो अल्ट्रासाउंड था, उसके अंदर आपका यूट्राइन फाइब्रॉइड था जो 10.5 इंटू 10 सेंटीमीटर, नॉट मिलीमीटर, सेंटीमीटर का 10.5 और 10 सेंटीमीटर का जो था एक यूट्राइन फाइब्रॉइड था। और उसके साथ में आपको एडिनोमायोसिस गॉल ब्लैडर के अंदर जो एक थिकनिंग आ जाती है वो था। आपका ट्रीटमेंट जो चला, उसके बाद आपने अप्रैल के बाद सीधा हम लोगों ने 8 महीने के बाद 17/12/2022 को लगभग 8 महीने के बाद जब टेस्ट करवाए, तो आपका जो सोनोग्राफी था ब्रेस्ट का, उसका जो बायरेट्स कैटेगरी 4A का चला गया था, वो नॉर्मल आ गया 2 पे आ गया। और जो पेट का आपने जो फाइब्रॉइड की बात करते हैं, तो 17 दिसंबर 2022 की रिपोर्ट 8 महीने के बाद आपका जो साइज है वो 1.4 इंटू 1.1, ऑलमोस्ट नेग्लिजिबल या बहुत कम आ गया, सेंटीमीटर तक आ गया। ये तो है आपकी रिपोर्ट जो आपने डायग्नोस्टिक जो इन्वेस्टिगेशन के जरिए पता चला। लेकिन आपने अपनी इमोशनल फिजिकल जो सिम्टम्स थे, जो जिसकी वजह से आप मेरे पास आई थी, उसमें क्या क्या चीजें आई मुझे बताइए, थोड़ा एक्सपीरियंस आपका क्या रहा?
सर, दिसंबर महीने में जब ये अल्ट्रासाउंड मैंने मेमोग्राफी कराई ना, तो कराने के बाद मेरे को खुद इस बात का यकीन हो रहा था कि मतलब सचमुच मुझे इतना ठीक हो रहा है, मैं यकीन नहीं कर पा रही थी खुद पे कि ये ठीक हो रहा है। मेरे को लगा ये हो नहीं सकता, मतलब कि मेरे को नहीं लग रहा था, मेरे को खुद पे यकीन नहीं हो रहा था कि मेरे ठीक हो गया ना। उसके बाद में साथ में मेरे को जो मेंटल कंडीशन मेरी ना बहुत ज्यादा अपडेट हुई है 8 महीने के ट्रीटमेंट से और काउंसलिंग से। तो एक तो मेरे को वैसे था स्ट्रेस, एंजाइटी और डिप्रेशन मेरे को पिछले बहुत सालों से चल रहा था।
आपकी मैरिज जो है वो कब हुई थी?
मेरी मैरिज 2003 में हुई थी सर।
2003 में हुई थी, ठीक है।
और बहुत ऑलमोस्ट इतने साल हो गए, तब से मेरे को डिप्रेशन में मैं सफर कर रही थी बहुत सालों से। तो
कितने सालों से डिप्रेशन वगैरह एंजाइटी का जो वो चल रहा था?
मेरा तो अंदाजा है मतलब 16-17 साल से मैं डिप्रेशन में सफर कर रही थी।
अच्छा,
बहुत साल। एक डिप्रेशन मेरे को था ना, मतलब 24 आवर्स हमेशा रहता था सर।
What was that? क्या था?
मतलब उसमें था, एक स्ट्रेस होता था, एक एंजाइटी होती थी, एक फियर होता था मेरे को।
किस चीज का फियर?
एक फियर होता, अननोन फियर था मेरे साथ बहुत सालों से। मेरे को खुद को पता नहीं था कि फियर क्या है, क्यों हो रहा है। और इस फियर का अटैक मेरे को ड्यूरिंग डे टाइम आता था। कभी मैं ड्यूरिंग डे टाइम कभी सो गई 10 मिनट के लिए, आधे घंटे के लिए, जब मेरी आंख खुलती थी ना सर, तो मेरे को एक सीवियर अटैक फियर का आता था कि बस मैं अब खत्म होगी, मतलब मैं अपनी मौत को देखती थी उस टाइम पे। मैंने बहुत बार आपसे बोला कि मैं ये सफर कर रही हूँ। अभी कभी मैं सो जाऊँ, कभी मेरे को नींद आए, तो मैं मतलब जब उठ जाती हूँ तो रिलैक्स होती हूँ, मेरे साथ वो चीज अभी होती नहीं है।
वेरी गुड, ठीक है।
और एक मॉर्निंग में मेरे को ना मतलब एकदम अर्ली मॉर्निंग डिप्रेशन का एक सीवियर अटैक आता था। कि अगली मॉर्निंग जब मेरी आंख खुलती थी ना, इतनी जबरदस्त घबराहट मेरे को होती थी, मैं आपको मतलब एक्सप्लेन नहीं कर सकती हूँ क्या होता था। एक घबराहट होती, पता नहीं क्या चीज है, क्या फियर है मेरे साथ भी, कैसे मैं उठूंगी, कैसे मैं घर के काम करूंगी।
This is the statements of Calcaria Carb. You can see what Calcaria Carb is actually. She is typical Calcaria Carb person.
क्या होगा मेरे साथ, क्या मेरे से कोई बोलेगा, मैं कर पाऊंगी या नहीं कर पाऊंगी, वो सारा मिक्स हो के ना मेरे को मतलब सप्रेस कर देता मॉर्निंग में।
कैसे क्या?
तो फिर जब मैं उठती थी ना, उठ के अपना रूटीन का काम करती थी, जब उससे मेरा ध्यान थोड़ा हटता था ना।
Is it comprehensible to the students sitting in the last seats? Yes, say yes or no. Okay, thank you, thank you.
तब मैं ठीक हो पाती थी, और डेली का सफरिंग था, मतलब मेरे को पता नहीं था इसको कैसे ठीक करना है। अभी आज की डेट में कभी मैं मॉर्निंग में उठती हूँ तो मैं खुद को अब देखती हूँ ना मिरर में, शीशे में, तो मेरे को एक तो अटैक नहीं आता है फिर का, और मैं खुद को देखती हूँ मतलब फ्रेश महसूस करती हूँ बहुत ज्यादा।
आपने मुझे उस टाइम पे बताया था कि आपको जो एंजाइटी है वो बच्चों को लेकर बहुत होती थी।
बच्चों को लेकर बहुत ज्यादा होती थी। एक तो फैमिली में मेरा जो एनवायरनमेंट था ना, मेरे को कभी पॉजिटिव सराउंडिंग एनवायरनमेंट प्रोग्रेसिव कभी मिला नहीं था, ठीक है, उसमें कभी मैं संभल नहीं पाई थी। बच्चों को लेकर इतनी पॉजिटिवनेस थी, मैं आपको बता नहीं सकती हूँ। बच्चों की पढ़ाई को लेकर, बच्चों की हेल्थ को लेकर, घर के काम की परफेक्शन को लेकर, उसमें पूरा एक जैसे घोड़े दौड़ते हैं ना एंजाइटी के, वो पूरा दिन 24 घंटे दौड़ते थे। और अब अभी मेरे साथ वो चीज नहीं है, मतलब बहुत हद तक रिलैक्स है। आई थिंक 80% मेरे को रिलैक्स है।
अच्छा, जो आपने कहा कि आपको ऐसा महसूस होता था काम काज को लेकर, आपकी बहुत स्ट्रेस है, आपको टेंशन हो जाती थी, वो क्या होता था? एक्सप्लेन कीजिए।
वो ऐसा था जैसे मेरे को किसी को मतलब बार बार टोकता है ना, मतलब कि आपने ये नहीं किया, आपने वो नहीं किया, मतलब वो चीज जब लॉन्ग रन चली ना, तो मेरे साथ ऐसा हो गया कि मतलब मेरे को जैसे लग रहा है कि ऑब्जर्व कर रहा है।
कैसे?
मतलब ये टाइम में, इतने टाइम पे मैंने अपना काम खत्म करना है, अगर 2 मिनट भी लेट हो गया तो पता नहीं क्या होगा, मेरे को कोई क्या बोलेगा।
She is explaining the delusion that because of the continuous observation of the patient's family, that you have not done this or that, this or that, this or that. So she was very much anxious about the work done in the particular time period only. So she started feeling that delusion that someone is observing me what I am doing. So she is explaining that delusion which she had earlier.
वो मतलब खुद की एंजाइटी खुद में अंदर से चलती थी।
वो ऑब्जर्व कर रहा है, वो आपको कैसे लग रहा था? कैसे, क्यों, कोई आपको देख रहा है? क्या देख रहा है?
मेरे को लगता था कि जो मैं काम कर रही हूँ मेरे को ऑब्जर्व करेगा, बाद में बोलेगा कि ये सही नहीं हुआ है।
अच्छा,
तो वो आवाज अपने आप से पीछे से आती थी,
अपने आप
आवाज आती थी पीछे से।
ओके, वो जो इमोशनल इश्यूज थे आपका, एंजाइटी का, डिप्रेशन का, ये चीजों का, वो अभी ऑलमोस्ट गॉन, खत्म हो गया?
यस, ऑलमोस्ट मतलब 90% खत्म हो गया।
90% आपका चला गया।
अभी जो 10% आता है ना, तो उसको मैं सोच लेती हूँ कि मैं इसको यहाँ पे स्टॉप कर देना है, ऑलमोस्ट इसका इफेक्ट मैं अपने आने नहीं देना, इसको रिवर्स कर।
90% she has overcome the anxiety, depression and fear. She says the rest of the 10%, if it all comes to me, I handle that boldly.
अपने मतलब खुद की पॉजिटिविटी से मैं उसको रिवर्स करती हूँ, कि प्रॉब्लम कभी आती है तो उसको रिवर्स करती हूँ।
और जैसे आपको पीरियड्स के टाइम पे, जैसे आपने मुझे बताया था कि आपके जो मेंसेस थे उसके,
when I prescribe Calcaria Carb, if I find the symptom that there is painful menstruation at the beginning of the menses, Clark and Herring says this is one of the important medicine for the patient. Periods painful at the beginning, then Calcaria Carb, I think about Calcaria Carb.
आपको इशू रहते थे जैसे पेन वगैरह?
इशू बहुत रहते थे सर, शुरू से ही मेरे पीरियड्स पेनफुल रहे हैं। मेरे पहले तो जो साइकिल था ना पीरियड्स का, वो 32 डेज 35 तक भी चला जाता था, 30 भी आता था।
Now she says that the cycle of my menses, now she is 45 and she says that at this age of time also I have now regular period of 28 days.
पर अभी मैं खुद ये बता रही हूँ कि मेरा जो साइकिल है 28 पे मतलब आ गया, 28 डेज का। मेरी 45 की एज में मेरा पीरियड का साइकिल जो वो 28 डेज का परफेक्ट हो गया। और मैं सोच रही हूँ पिछले मतलब कि 4-5 महीने से रेगुलर बेस पे 28 डेज चल रहा है।
और उसमें जो पहले आपको पेन होते थे,
क्रैम्प्स आते थे, पेन होती थी, बहुत ज्यादा होती थी, एक दिन तो इतनी ज्यादा होती थी पूरा दिन मैं बेड पे आती थी, जैसे में किसी ने मेरे को मार पीट के बेड पे डाल दिया ना, वो मेंस्ट्रुअल पीरियड्स मेरे को वो पेन होती थी। अभी मतलब माइल्ड होती है, इतनी नहीं होती, मतलब बहुत इसमें रिलैक्स है मेरे को।
और आप जब मेरे पास आई थी तो आपको थोड़ा सा, मैं देख रहा हूँ कि आपकी जो फिजिकल फिटनेस है थोड़ा सा अच्छा लग रहा है,
अच्छा लग रहा है, बहुत अच्छा, बहुत ज्यादा अच्छा लग रहा है।
क्या वजन में कुछ कमी आई है, कैसा क्या था?
Can you see the pleasure of prescribing, the smile, the satisfaction without any any surgical knife, Calcarea Carb has taken due care of all of 3 complaints. So this is the last slide. So what about the purpose of the visit? As she was advised to go for surgery, our Calcarea carbonica played a very successful role of surgical knife, as simultaneously it has taken care of 3 major surgical conditions: uterine fibroid, gallbladder adenomyomatosis, and fibroadenomas without surgery. So the purpose of the patient is fulfilled. Thank you very much. Thank you one and all. Thank you. Thank you very much. Thank you.